So we have a couple red flags that we look for in personal and family histories to see, is there a high risk for the cancer running in the family to be caused by something genetic, or basically something we can pinpoint in someone's genes that's been passed from generation to generation that increases the risk to develop cancer. The biggest one, and the one we see the most often, is early onset breast cancer. By early onset, what we usually mean is premenopausal or basically under age 50. We also look for the kind of the characteristics of the breast cancer. So what we call triple negative, which basically that means it's looking at how estrogen and progesterone, which are two hormones that women have, are expressed, and how a protein called HER2 is expressed. Now, if all of those are negative, that's a higher likelihood for there to be something genetic. So we look for that as well. We also, like I said before, we look for ovarian cancer really at any age, but if it's earlier onset, it's a bigger red flag for us. So under age 50 as well is the cutoff that we use for that. If someone has breast and ovarian cancer in the same woman, no matter how old they are, age of onset doesn't really come into play with that one. That's going to be a big red flag as well. We also look for bilateral breast cancers or multifocal breast cancers in the same breast.
And what is that?
Multifocal basically is just two completely separate cancers in the breast tissue. So not a recurrence, not something that's spread to the other side, not the same cancer going somewhere else, but two brand new cancers that are completely independent of each other. And then we also look for multiple affected generations in a family. So basically, if someone's grandmother, their mother, and themselves all have had breast or ovarian cancer, that's concerning. You know, we usually would expect to see it not as common in a family. We usually, when we see multiple affected generations, it's going to be a red flag for us as well. And then a big thing is someone's heritage or their ancestry. So if someone's of Ashkenazi Jewish heritage, they have a much higher risk of having a hereditary breast cancer risk. And then male breast cancer is a big one. It's so uncommon in the general population, even though it does happen. But when we see a male breast cancer, it's a big red flag for us to look at the rest of the family, see if there's something going on that we need to be aware of.